Hi, Dr. Lee.
Hi, Dr. Birdsall. How are you?
I'm good. Thank you so much for taking the time to let me do a brief interview from afar on Zoom, like most interaction these days. Let me just quickly introduce you to our Seichi clinician. So Dr. Torna Lee has been working with Seichi for many, many years in California. She's one of our senior clinicians. She's a clinical trainer for us. And she also acts as an interim coverage clinician. So she's full-time in the field. But in addition to having her own permanent facilities, she also helps us cover new buildings that we're bringing on, or if there's a temporary coverage at a building. So I think it's safe to say you've probably worked in more facilities than most of our CT clinicians. And so you have a really good, I think, just understanding of this industry and the different types of cultures and facilities we can have. And you're out there working now in the fields, going to your facilities in person during the COVID crisis. So I just wanted to ask you some questions about your experience. And this way, our other clinicians can kind of see what it's like for other providers and feel that connection as we're all out there during this trying time. So thank you. So the first question I have is just thinking about how practice is different, right? How your services are different during the COVID crisis. What's kind of stood out to you about how you're delivering services during this time?
I do have to make some modifications. I think every facility has their own safety requirements. Some have hand washing stations outside of their doors. Some doors are locked. You have to knock before you go in. So that's been the more just kind of obvious. It's being mindful about the facility's requirements and making sure, there's a contact precaution sign at the door to always double check. Don't just walk in. I know it's easy for clinicians to just kind of walk in and go, back to back see their patients. So that's been a little bit different. Double masking too, just to keep myself safe and keep the patient safe. I have that on. I don't touch it. I don't change it. Also standing by the door when I'm doing sessions, if I can. If the patient's in bed A or they're really close to the door, I'll try to stand by the door. If they're further into the room, I'll go in, but I still try to keep my distance. So I'm not standing at the foot of the bed. I try to stand by the wall if I can. It can be a little challenging for the ones that are hard of hearing. I do find myself speaking louder and it sounds like I'm screaming at them, but I'm not. So that's been a little bit different. What else? A lot of hand washing, of course, using hand sanitizer between each session. Oh, and then not moving the patient. So that's been different. So not taking them in and out of their room, even though they're on their wheelchair. I just ask them, is it okay if we meet in here, given the circumstance? And then they all understand for the most part.
Right.
So that's a little bit different.
Yeah. So it sounds like, a lot of, doing treatment in the room may not be 100% private, but kind of just the nature of the circumstance and making sure that you're asking them. And a lot of standing, it sounds like, right? So you're kind of standing by the door, standing, as far away as you can from bed B. So I bet you're pretty tired by the end of the day.
Yeah, I wear flats. I should probably wear tennis shoes. I don't think anyone would care, but yeah, a lot of standing. I think it's just the best situation to keep myself safe and keep the patient safe. So
thank you for doing that. I know that's probably an exhausting day, and I'm sure your patients appreciate that you're there, right, and standing and holding strong for them. So a lot of PPE and at a distance, has that impacted your patients at all, right? So you're doing your services with double mask on, 6 feet or more away. What's that been like for your patients?
Surprisingly, I haven't gotten a negative response to that. I think they understand. I think they feel safer that I am wearing all this gear because I don't live at the facility. I go home, I go to the grocery store, I come back to work. So for them, they see that I'm suited up and I think it makes them feel better. At least I haven't gotten any complaints about it. And overall, I think they're just pretty receptive to having someone consistently show up and provide the continuity of care for them. A lot of people aren't able to, and they can't. They're kind of isolated in their rooms. They're not able to engage with other people. So for me to go in, they've been really receptive to it.
That's wonderful to hear. And that makes sense to me. And I'm glad to hear that it doesn't seem to be too negatively impacting them. And I didn't think about the opposite, that they feel safer, right, too, knowing that you have the right protective gear on. Okay, that makes sense. And lastly, I have a ton of questions, but I want to keep this brief for our providers. This is just such a scary time for so many people, right? And as providers, we're going in and we know that our patients have elevated symptoms and they're feeling, trauma and loss and grief and high anxiety. You're working with staff that's under extreme pressures and a lot of emotional distress. And then for you, right, for our providers who might have lost patients or in that setting, it's a really trying time. And so I know this might sound like an unusual question, but I'm wondering, has there been anything that's been meaningful to you, right? Or anything that's, been an experience that you have felt has been positive to you in this situation?
Good question. I think just simply being able to show up, having the power to show up. I'm healthy enough to show up for them. I think for the residents and the patients, a lot of times, certain staff members that they've been working with haven't been able to come in because they've had to deal with their own family, problems. Family members of the residents cannot come in. All the doors are closed. There's no family visits. So for them, I think just, again, having someone to be able to show up, to me, that's the most meaningful. I see it in their faces. I see it when they're like, oh, Dr. Lee, you're here. Like, you're here. I'm like, yes, I am here. But, another funny thing is I had a conversation with my husband a couple weeks ago and we were watching TV. It was just these commercials after commercials about like, oh, thank you, healthcare workers, heroes work here. And then you can get a free healthcare worker meal at McDonald's or something like that. And he turned to me and he was like, are you a healthcare worker? And then I was like, I am a healthcare worker. I don't know why I hesitated to say that, but I think as a provider, we don't really think about that immediately. For me, I think, oh, nurses and doctors and and I was like, wait a minute, I am a healthcare worker. And then I told him and he was like, well, thank you for doing your job. It was so cute. And just getting that reinforcement that yes, I am a healthcare worker. Again, I am able to be there and provide the care for them, especially during this time. So that's been pretty powerful. It just reminds me of this is why I'm doing this. It's easy to kind of forget when you're really stressed out. So that was kind of sweet.
I love that. I love that story. And I love that answer. Yeah, that, the most meaningful part of this is that you get to be there for your patients and continue to be there and that you are essential and you're supporting them during this time and you're able to do that. That's really a wonderful answer. Thank you, Dr. Lee. I appreciate that. Well, those are the questions I had. And I just want to say, like your husband, thank you for being a healthcare worker, for providing the essential service. You are so important to us at CHE, just like every provider out there, doing this amazing work, which is just, made that much more special right during this time when it's needed now more than ever. So thank you.
You're welcome. Thank you, Dr. Birdsall.
Take care.